it's Dr. Sheila here. So, inflammation and illness. Now, this is a concept I really wish I had understood in medical school and residency in order to look at the bigger picture of illness. So, signs of inflammation are exactly what we've gone through already. I think you all are going to be or are familiar with these. So, it's eczema, it can be recurrent ear and sinus infections, chronic runny nose, constipation, stomach pain, behavior issues, mood swings, troubles with transitions, mouth breathing, snoring, the little boy in the middle, the pale face, pale skin. And the concept that I love to teach about is inflammation equals symptoms. The analogy I like to use is a glass of water. So our body can handle a certain amount of inflammation before we have symptoms. In fact, we need some inflammation. And what happens is that we are all running around so inflamed that we're walking around with these runny noses, the constipation or the loose stools, the muscle aches and pains, joint pains, headaches, skin issues. So it's when that water is overflowing that we are having symptoms. So if we think of our body as the cup and the water is the inflammation, if we say, okay, what's causing that inflammation? And maybe we have some environmental allergies, and then maybe we have a dairy sensitivity. So if we say, okay, we're going to take out the dairy because we can't cut down all the trees and dig up all the grasses. So we're going to take out the dairy and we're going to take that cup to where it's only a fourth or three-fourths full or a half full maybe. Then when we get our seasonal variations of the allergies, we're going to get some more inflammation, but it's maybe only going to go to about three-fourths full. So we're not going to have the symptoms that we would have if we still had all of the dairy inflammation in there. So this concept really has helped me look at that bigger picture because we've been able to throw away allergy meds, asthma meds with lots of different kids once we get their systemic inflammation under control. I'm going to go through this case. So he's the little boy. You've seen his picture already. And he was a little fella who came in because he had ticks pretty badly. He'd had ticks so badly that he'd pulled a muscle in his neck. And so what we did is we went through the 7 steps, and at that point in time, we actually took dairy out. The dairy didn't make much of a difference. At that point in time, the way that I was doing this is I would put the dairy back in and then I would take the next food out. I don't do it like that anymore. But at any rate, we put the dairy back in and then we took gluten out. And gluten was his big trigger. His ticks resolved by 80%. And when you look at the 2 pictures, the family brought the photos in for me to use because they know I do a lot of education and they wanted other people to know this because it had such a profound impact on his life. So the photo on the left, you see how he's pale, he's got the dark circles under his eyes. He doesn't really have a clarity to his look. And then the picture on the right, he's got beautiful coloring. He's clear, bright-eyed. He doesn't have the dark circles under his eyes. So that the child on the left is a child who, to me, his gut is inflamed. He's not absorbing his nutrients properly. And on the right, you can see all of that with the beautiful coloring. It's a good example, and these are the kids that I can see them from a mile away, and if I see them out in public, it takes every ounce of self-control I have not to go talk to the parents about it. But that's where we have to get his gut inflammation decreased so that his body is able to break down and absorb his nutrients effectively and efficiently. So I hope that makes sense. Then with this concept of inflammation being symptoms, and then we group symptoms and we call those diagnoses, the pharmaceutical industry knows this very well. Many of the drugs that we use are aimed at decreasing inflammation. So if you look on here, these are many different forms of steroids as well as ibuprofen, which is an anti-inflammatory. So we use steroids, we inject them, we squirt them in our nose, we put them on our skin, we take them orally, we inhale them. So all of those are different ways at decreasing our body's inflammation. This is a billion-dollar industry. in integrative medicine, what we do is we say, okay, we recognize this. Let's use food and whatever we can naturally to decrease inflammation. So, how have we gotten so far out of balance? The food that we eat is highly inflammatory, and about 150 years ago, vegetable oils were introduced into our food supply. And this is where we started really mass producing things. And vegetable oils are like corn oil, safflower oil. Those are, we cook everything in those today. Any kind of restaurant food, many kids, especially all the crunchy snacks that can taste so yummy. But those are all omega-6 fats. So the omega-6 fats are pro-inflammatory. And the omega-3 fats are anti-inflammatory. What has happened is we just have so many more omega-6 pro-inflammatory fats in our diet that we've unsettled that balance. So here are the nature's anti-inflammatory foods are the omega-3s. And these are things like salmon, tuna, the cold water fish, walnuts, almonds, eggs if they're good, farm-raised chickens, those eggs are going to have some omega-3 fats. The chia seed, flax seed, hemp seed, those are why I love, because those are nice vegetarian sources of the omega-3 fats. So those are just some of the ways that we get them into our system. And I do use supplements for the omega-3s because most of the kids that I see, most of the kids in the country, I think, have some degree of omega-3 fat deficiency. And it's extremely important, and I'm going to talk about that. But why are they so important? You are what you eat. Your grandmother was right. This is a little bit of a science geeky slide. If you look on the left, that is a cell membrane. It's just showing the cell, and the cell wall is what's over on the right. It's got you see the little orange, the round orange head with two tails. That is an omega-3 fat, and that is they call it a phospholipid bilayer, and that is what's around all of our cells. And that bilayer is made up of omega-6s, omega-3 fats. And if we have a really high ratio of the omega-6s to 3s, when we get cell breakdown, which we get all the time as our body is living and metabolizing things, we will get an overall increase in inflammation. If we have a more balanced omega-3 to 6 fat ratio, we are going to have a decrease in inflammation when we get cell breakdown, or at least not as pro-inflammatory. So literally what we're doing by increasing omega-3 fats is this is a long-term solution at decreasing systemic inflammation. And it also plays a big role in how our cells are able to move, how our neurotransmitters are able to work, and they send our signals throughout the body. I'm always talking about this, especially if we have kids with attention challenges or if we have kids who need a medication. My goal is always to get our cells in the best shape possible so that we can use the lowest dose possible of the medication that we need that will be most effective with the least side effects. Now, this is another geeky slide, but this is for those of you who really want to look at the science behind it, the biochemistry. So these are the pathways, or this is the pathway of inflammation on the left. So you see the N6 family, that is the omega-6 family. So those are the pro-inflammatory fats. And you see how they get broken down into that AA, arachidonic acid. So arachidonic acid is that is the inflammatory bomb in our bodies. And if you look, it's got prostaglandins, thromboxanes, prostacyclins. So and then it shows COX-1, COX-2. That COX-1, COX-2, those are medications that are aimed at blocking the inflammation. But if you notice, once the inflammation is out of the bag, the medicines they're not getting at the root of it. They're getting the inflammation after it started. What we want to do is we want to go back up to the top of this pathway where it's linoleic acid, and we want to make sure that we're getting that correct ratio of the omega-6s to the omega-3s. So now we're going to go down to the omega-3 family, and that is the pathway down the right, and you'll see this is the anti-inflammatory pathway. So this is where it goes down to the EPA, the eicosapentaenoic acid, and then the DHA, which is down below. That's a docosahexaenoic acid. And those are both the good omega-3 fats that we want to have in our bodies. And these play a big role in development of babies' brains, and I'm going to talk about that in a minute. But you'll see on the right where it goes through some of the foods that have the omega-3 fats, and that's fish oil, some of the meats like grass-fed meats, and so those are the things that we want more of because those counteract that arachidonic acid. And we need inflammation to a certain point. If we cut our finger, we have to stop the bleeding. If we sprain our ankle, we need to send white blood cells to that tissue in order to heal the damaged tissue. But what's happened is we are just walking around and we're little inflammatory bombs. So if we get a virus, our body goes whoosh, and it sends a bunch of cells to the area where the virus is, and we just get a whole lot of symptoms. And that's also pretty classic for kids with asthma, is they are often will have a lot of systemic inflammation that we need to deal with so that when they get exposed to their triggers, whether it's an environmental allergy, a virus, that they are not going to have that huge influx of inflammation into their lungs. They have almost a hyperreactive response. Then if you look below the slide where I put 1-to-1 and 15-to-1. So when we were in the days of being hunter-gatherers, our ratio of omega-6 to omega-3 fats that we ate was thought to be about 1-to-1. Now it can be anywhere from 15-to-1 to 25-to-1. So you can see how far we've thrown that out of balance. We're changing our meat sources. So cattle are meant to eat grass, and grass has omega-3 fats in it. What we've done is we feed them grain, and grain like corn, and grain is an omega-6 fat. So we've even gone and changed the cell walls of the meat that we're eating, so even the meat has more omega-6 fats in it. So why are they so important? From early on in the third trimester of pregnancy, the baby's brain, that's when the baby's brain rapidly begins to accrue DHA. Remember, so that's one of the omega-3 fat components. And 60% of a baby's brain are made up of structural fats, and 25% of that is DHA. So that is why in studies, it shows that when moms who are pregnant supplement with omega-3 fats, they have half the rate of postpartum depression. That's just in the moms, but we know that's critical in the development of the baby's brain. Because if mom doesn't have enough of the omega-3 fats, the baby is going to take everything that mom has, and so mom is going to become depleted. So if anybody is pregnant or you're still going to get pregnant, that's definitely something you want to think about, really upping your omega-3 fats while you're pregnant, and in particular in that third trimester. Omega-3 fats are important for cerebral functioning. That's our balance. All of our nerve cells talking to one another can affect the retina, visual learning, and memory function. Pretty much omega-3 fats have a role in almost every aspect of our bodies and our metabolic processes. Essential fatty acid deficiency, so that's what these omega-3 fats are considered. It's an essential fatty acid. That means our body does not make it, so we have to eat it. And it is associated with being very thirsty, dry hair, dry skin, the keratosis pilaris, that's the bumps on the back of the arms, the cheeks or the legs, brittle nails, eczema, ADHD. There have been studies done, in particular in boys, they'll send their blood off, and they actually look at the red blood cells and they look for essential fatty acids, and they can be low. And it's especially if you have a child who has attention issues and they have any of those other associated symptoms of the dry skin, dry hair, eczema, things like that. So what can we do about it? This is one of the reasons I love smoothies for breakfast, because we can get a good helping of the omega-3 fats in the smoothies. So you'll see me coming back and back to this. And this is, with the smoothies, we want to continue to work at getting more of these other really healthy foods in it and less of the fruits, so that we're not getting too much sugar. And it's the same thing with the milks. I'd rather that we're using water as the base, so that we're not doing like chocolate almond milk and things like that. And absolutely do those now when you need them, but gradually we can start shifting those. And then I just wanted to and I wanted to show you the microgreens on the right. Microgreens are something I love, and I buy these every week at the farmer's market. And I put probably a cup, at least a cup, in my smoothie every day. And these are where you plant the seed and they let them grow for about 2 weeks and then cut them. And microgreens have about 30 to 40% higher nutrient content than the adult plant. So that's great, a great way to pack nutrients into the kids. And they're very mild tasting, so they won't off the taste of a smoothie too much. And I would start out with just a little bit. This is how I do it. I just wanted to show you this because I have a Ninja. So I pack it up the night before, and this actually has, I think this was last summer, and I had fresh peaches, so I have a little more fruit in there than I normally do, and a little less greens than I normally do. But what I will do is I'll do that, and then I stick that in the refrigerator, and in the morning I pull it out, I put in a couple tablespoons of chia seed, I add my water and blend it up, and then I actually put it in, I have just like a nice little jar that has a good sealed lid, and I stick that in my purse, and I drink it on the way to work with my supplements. I wish I were sitting, listening to the birds chirping and having my breakfast, but I am not a morning person, so that is how I do my smoothies. But I've been doing a smoothie for breakfast for probably every day for 4 years, and I feel better now than I ever have, and I think that's part of it. The other thing that I'm just going to touch on briefly here are probiotics and fermented foods, because I want you to, in addition to increasing the omega-3 fats, we're going to just start to do a probiotic and fermented foods. These play a big role in decreasing the inflammation of our gut. We need the good, healthy bacteria in our gut in order for our guts to work properly, to digest and absorb our foods. And we're going to talk a whole lot about gut health and the fact that we have more bacteria in our gut than we have cells in our body. And we're going to talk about that in the gut health module. But you can get many different kinds of fermented foods. You can get sauerkraut, kimchi, kombucha, pickles. But when you're getting a fermented food, you want to get, it needs to be fermented and not pickled. So you don't want to have vinegar in it. Vinegar pickles things. The fermentation process is over time. And what I do with some of our families is, if you can find a good organic, like a sauerkraut even, you can just do half a teaspoon twice a day or a teaspoon twice a day. And that's a great place to start. The probiotic is called Planidophilus, and it is just a single strain, low dose probiotic. It's very gentle, and we see amazing results with it. Okay, so I just wanted to give you the overview of inflammation here, and we want to, of course, continue the best daily practices that you're doing, drinking plenty of filtered water. Our good rule of thumb is half the child's weight in ounces. For a 32-pound child, we would drink 16 ounces a day. I want you to get outside daily, play, barefooted if possible, limit screen time. And then just a quick review of this video. So inflammation equals symptoms. Be a keen observer of inflammation so that you can start to be aware where we can decrease that. So it's not only seeing the physical signs of it, but going as they're eating food saying, oh wow, is there vegetable oil in that? Are there, is that food pro-inflammatory or is it anti-inflammatory? And so basically green leafy vegetables are going to do a ton for all of us. They have so many healthy properties, and So if we're thinking about we know the foods that have the good omega-3 fats, and if we're doing vegetables, those are really important. And then we, of course, have all of our other foods, but we just try to do less and less of the pro-inflammatory foods. And the omega-3 fats are a fabulous natural way to decrease inflammation. So do you want to think about doing maybe rice and chicken with avocado, soups, lentils, things like that, and increasing the omega-3 fats? Start adding fermented foods, and then consider adding the probiotic. All right. Thank you so much. Have an amazing week. This is a picture of my sister. We were up in Alaska. We have a cousin who lives up there and has the fishing boat. And so we go catch our sockeye salmon in the summertime and then ship it home so we can eat fresh sockeye salmon. But that is the best kind to get. If you get Alaskan sockeye salmon, it is going to be one of the lower contaminated fish. Any fish that you get in the ocean these days is going to have some contamination, but if we keep our gut really healthy, we're going to be able to deal with those toxins a little bit better. Okay, thank you so much.